encephalitis means inflammation of the brain. So once the brain is inflamed, you can have particular manifestations. Initially, you can have patients having mental status changes. For example, someone who is very talkative suddenly becomes very quiet, or you would notice that that particular patient is not paying attention to his or her work. She would be distracted. So initially, there can be some sort of behavioral changes, and then eventually, that patient can have decreased sensorium, in the sense that from a previously awake patient, suddenly he would be very drowsy, sleeping a lot of during the day or during the night, not waking up enough to eat, and then eventually it can be a very fast progression to seizures and even coma. There are some neurological conditions that are similar or can present similarly with encephalitis. That's why at the outset, some people might think, oh, you're having a stroke, or you're having other things that can present with similarly. But the thing is, you really have to go to the hospital first and foremost so that diagnostics can be done, and then eventually it can be established that this is really encephalitis. Right now, the most accurate test to detect encephalitis would really be a lumbar puncture. This is the collection of CSF fluid bathing the brain. It goes down to the spinal cord. So once we collect this fluid, we'll be able to identify if a patient has encephalitis, either an infectious or autoimmune encephalitis, and then we can start the necessary treatment.